Most people who inject illegal drugs don't always use clean needles, and risk catching HIV and hepatitis as a result, U.S. health officials said Tuesday. But more than half use a clean syringe at least sometimes, which is progress, the Centers for Disease Control and Prevention said. A CDC analysis from 22 U.S. cities found that 54% of people who inject drugs had used a needle exchange program in the past year, up from 36% in 2005. But a third said they had shared a needle at least once within the past year. That's not good enough, the CDC said. The prescription opioid and heroin epidemics are devastating families and communities throughout the nation, and the potential for new HIV outbreaks is of growing concern, CDC Director Dr. Thomas Frieden told reporters. Activists in Indiana, where drug abuse has caused a small outbreak of the AIDS virus in recent years, say they know one reason why many users still are not getting clean needles. Some state governments are making it hard to do so. Even though Indiana government officials reluctantly eased a ban on syringe exchange programs at the CDC's urging, they provided no funding for them and are making advocates jump through hoops to get programs started. The issue pits well-meaning lawmakers against doctors and other public health experts, with a confused public in the middle. CDC and other experts say decades of studies show needle exchange programs work not only to stop the spread of disease, but to help people stop their abuse of drugs such as heroin and other opioids. Many people, however, are worried about encouraging a deadly practice. We do understand that when people first hear about syringe exchange programs, they wonder why anyone would do that, Frieden said in a telephone briefing. The science shows that syringe service programs work. They save lives and money. Study after study shows they don't lead to increased drug use or crime, he added. And then there are moral judgments. Oftentimes people are against needle exchanges because they believe that people who use drugs have made choices and should suffer certain consequences of those choices, said Chris Ebert of the Indiana Recovery Alliance. One of the community groups improve access to exchanges. HIV and hepatitis C both spread via shared needles. In the U.S., 3,900 people become infected each year with HIV because of shared needles, 9% of new infections. In recent years, injection drug use has also contributed to a 150% increase in acute cases of hepatitis C infections, the CDC said.